All right, before we start, I do want to flag that this webinar will be recorded, but we will reserve the final 10 minutes of discussion for audience Q&A, and that portion will not be recorded, so folks can feel more open to asking questions. And more importantly, I want to take a moment to thank you all for joining us today and for taking the time to be part of this important conversation around vaccine safety and access. You should know that your presence here reflects a shared commitment to protecting and supporting families and strengthening the health of our communities together. My name is Mia Eyre. I'm policy manager for the Asian and Pacific Islander American Health Forum, and I'm excited to be moderating this panel today. In the wake of childhood vaccine schedule changing in recent months, our incredible panelists today will reflect the implications of these changes, speak more broadly to the strong scientific evidence behind vaccine effectiveness, and will explore the barriers to equitable access. We'll clarify facts and underscore the role of vaccines in preventing diseases and sustaining public trust in healthcare, particularly concerning infectious diseases like hepatitis B and tuberculosis that remain persistent challenges for our underrepresented communities, including Asian Americans, Native Hawaiians, and Pacific Islanders. As we're just starting the year, we are in a key moment for public health. For example, the American Academy of Pediatrics just yesterday came out with their updated childhood vaccine schedule, which continues to recommend vaccines to protect against 18 diseases and does not change their routine recommendations. So before we dive in, we'll share a few links to some helpful resources here to level set, and we'll be sharing these again via email following the webinar. The first resource here is a brief summary of federal changes along with some of our own translated resources. And now, before we dive into our panel discussion, I'd like to introduce our President and CEO, Juliet K. Choi, who will share brief introductory remarks with us.
Good afternoon from Washington, D.C., and thank you for joining us today for this timely and important conversation. We're gathering at a critical moment for public health, one that demands clarity and an unwavering commitment to science. For generations, vaccines have been one of the most powerful tools we have to protect children, loved ones, and entire communities. They work quietly, consistently, and effectively. And when vaccines are trusted and accessible, lives are saved. Yet today, that trust is being tested. As vaccines face heightened scrutiny, shifting recommendations, and increasing misinformation, many families are left feeling uncertain and unsure of what choices will best protect their loved ones. Confusion is not a small thing in public health. When clarity erodes, confidence diminishes. When confidence is lost, people are put at risk. To meet the moment, today's webinar was designed to provide a safe and trusted forum for this critical conversation. At its core, vaccine guidance must be clear, transparent, and rooted in evidence because trust is never automatic. It's earned through consistency and respect for communities' real concerns and curiosity. Today's discussion specifically centers on why vaccine access and protection matter so deeply for Asian Americans, Native Hawaiians, and Pacific Islanders, where the consequences of confusion and inaction has been especially high. Hepatitis B is a powerful example. It disproportionately affects AANHPIs and can lead to devastating outcomes, including cirrhosis, liver cancer, and death. AANHPIs account for over 50% of the estimated 2.5 million chronic cases nationwide. An estimated 1 in 12 AANHPIs is living with chronic hepatitis B, and many don't know it. According to CDC data, the death rate from hepatitis B in our communities is nearly 9 times higher than in other populations. These are not inevitable outcomes. These are absolutely preventable deaths. Vaccines show us what is possible when science-based prevention is trusted and sustained. Since the CDC began recommending a birth dose of the hepatitis B vaccine in 1991, annual hepatitis B cases in the US have dropped by 99%. These outcomes are not an accident. This is what happens when evidence guides policy and when communities are given clear and reliable information they can trust. In recent months, changes to national vaccine advisory leadership have raised concerns across the entire public health community. These developments remind us how essential transparency and scientific integrity are, especially for communities that have already borne disproportionate disease burden and have too often been overlooked. Today, I'm grateful and inspired by our expert panelists for lending their trusted and powerful voices, key leaders in our Health Forum National Health Response Partnership. NOELA Community Health Center is a federally qualified health center located in New Orleans and provides comprehensive, accessible, and culturally responsive primary care, behavioral health, and social services to underserved diverse populations. The National Council of Asian Pacific Islander Physicians is a national organization of physicians committed to the advancement of the health and well-being of their patients and communities. And the Pacific Islander Community Association of Washington is a statewide community-based nonprofit that establishes a cultural home, centers community power, and advocates to further the wellness of Native Hawaiian and Pacific Islander communities, physically, culturally, socially, and spiritually. Trust is built through conversations like this one. Again, thank you for joining.
Awesome. Wonderful. And as Juliet shared, I know we're eager to hear from our panel, so we'll get to it. It is my pleasure to introduce our panelists here. Thank you so much, Celie Savusa, Dr. Wu, and Dr. Winfrey. In a minute or two, could you each please take a moment to introduce yourselves and share a bit about what you do, maybe starting with Dr. Winfrey, then Dr. Wu, and then Celie.
Sure. Thanks, Mia. And thanks for the opportunity, Mia, to talk with you and share with the audience today. Again, my name is Keith Winfrey. I'm an internist and preventive medicine trained physician here in the New Orleans area. I also serve as the Chief Medical Officer for NOELA Community Health Center, and I've been in that role now for about 17 years. As was mentioned by Juliet, we are a fairly qualified health center serving a large Vietnamese population, African American, and Latinx population here in New Orleans.
Hi, I'm Susan Wu. I'm a pediatrician based in Los Angeles. I've been practicing for over 20 years in general pediatrics and hospital pediatrics. And in my day job, lead efforts in quality improvement, including increasing vaccine uptake and delivery. And I'm really excited to be here today. And thank you to Mia and Juliet. Celie?
Talofa, my name is Celie Savusa, and I'm the Executive Director of the Pacific Islander Community Association of Washington. We are a statewide organization, as you heard from Dr. Choi, and serving NHPI communities, families and communities. My staff is 100% NHPI. We're really the wellness has always been an ongoing kind of centered in the work here at PICA. And we're just really honored to be in spaces like this, not only to elevate the voices of community, but to help our communities also understand how the system functions in service to NHPI communities. So thank you.
Thanks all. All right, we clearly have an exceptional amount of expertise here, so I'll jump right in. To level set, could you all share a bit about why this moment is critical for conversations about vaccines access? What does the current scientific consensus say about the effectiveness of vaccines, and how have you seen changes in the perception of this in your communities? Dr. Winfrey, maybe we can start with you here and then Celie.
Sure. So, as Dr. Toy mentioned, vaccines are one of the safest and most effective ways to prevent the spread of infectious disease. And this has been well known for centuries now. Over the last 30 years, we've seen that regular usage of vaccines has averted about 508 million illnesses, 32 million hospitalizations, and 1.3 million deaths among children born over the last 3 decades. And so it's a very, very powerful and effective way at preventing the spread of infectious disease. And many of these diseases have devastating morbidity and mortality that we're trying to avoid. The concern now is that with the recommended change or the revision in the childhood immunization schedule, it has a potential of lessening the frequency of vaccine use and putting more of our children at risk for some of these diseases that we've been able to avoid for decades.
Yeah, I'd probably add on to that. What Dr. Winfrey was saying was the whole issue of trust. We know, those of us in nonprofit organizations and community serving nonprofits, that in order to partner with public health or the healthcare system, that the strong partnerships happen when we do this together. And so as the information changes in times like this, the tendency of misinformation creeps in, and our ability to continue to utilize the close connections and trust that we have with the healthcare system to provide clear, transparent information around vaccinations and what that means and keeping our communities safe. So I just want to say that.
Dr. Wu.
Yeah, I mean, to back to your question about why now, there has been no new information that is saying that these vaccines are not safe or not helpful. The data and the science still shows that these vaccines save lives, they save hospitalizations, and the scientific community, if you look at the American Academy of Pediatrics recommendations that were put out yesterday, that were supported by multiple professional organizations and developed by a group of experts in the field, still uh, still uphold the same information. So the recommendations that were put out recently to decrease the number of diseases protected by recommended from 18 to 11 was not based on any new information, or nor was it based on there was no transparent process, and no engagement of all the multiple experts across the different disciplines and fields in developing these recommendations. They were purely based on the desire to reduce the number of vaccines to match those of the country in Europe with the lowest number of vaccines on in their recommendations. So there hasn't been no monumental study that's been published that has contradicted the information we already know about vaccines being safe and effective.
Absolutely. Thank you all so much for that context. Those are extremely important points being made. I think I
And
can
yeah,
take us,
yeah,
yeah,
if I could just add,
absolutely, please.
just remind our audience that vaccines undergo rigorous testing before they're ever approved, and they're going to go continuous monitoring even after the approval process to ensure safety and effectiveness is ongoing. And so these are not, medicines or vaccines that are put out there without being rigorously tested and ensure that the highest utmost safety is available.
Absolutely. Yeah. Celie, did you have something?
Well, just overall in community, what I've seen in past experiences with discrimination and neglect or exploitation has created distrust in some communities, and that's a fact. So, but knowing what we know about the research about vaccines, and building relationships with folks with the medical system and the medical field, I think is critical for us to partner in service to the communities to provide access to vaccinations and other forms of healthcare. And I just, I can't say enough about how much the data, especially the data around vaccine, how much it's improved lives, even in poor communities that many of our families live. The data still is pretty strong. It's showing how they are helpful and they are effective for communities. So I just think, um, it, poverty is a fact, a reality for many families. Crowded housing, lack of insurance just makes vaccination a lower priority for many families. And so, how do we work in a way in partnership with healthcare, and with public health to make sure that we're able to service communities on a regular basis and give them access to vaccinations? Um, so yeah, I mean, how do we do this together? The stronger we can keep communities healthy with vaccinations, as long as we continue to work together in partnership with communities in the medical system.
Absolutely. Yeah, Celie, thank you for making those points. That touches on some of what I was going to ask you all next, which was what do you see are like the biggest barriers? Celia, you mentioned some, but what are the barriers and challenges to equitable vaccine access today? Whether that's, geographic, economic, cultural, or systemic, and how have you seen these disparities in vaccine access affect children, families, and our communities differently?
I mean, there's many areas that impact the lives of families, and creating access. And when I think about vaccinations, I think about many times that we have heard. Um, there's multiple families under one roof. Usually there's one car. And folks even trying to get to healthcare appointments, that's a challenge. And families are trying to figure that out. The lack of healthcare, lack of health insurance for families too, it continues to be a big barrier. And then, like we had talked about earlier, I had mentioned earlier, the trust issues. Um, Community members, BIPOC communities, been my experience that BIPOC communities are more comfortable going into spaces where people look like them. And in many of our healthcare facilities, some of them are pretty lily, and you know what I'm talking about. And I feel like I do a lot of time spending and building relationships with, our local clinics, with the healthcare system to figure out how do we partner with organizations and neighborhoods that have large pockets of Micronesian communities or Pacific Islander communities, Polynesian. So I just feel like many communities, especially non-English speaking communities, are not well versed in accessing information to register for appointments or vaccinations. So how do we just make it easier? And how do we make our system more accessible so folks can get information in languages, in meaningful ways, to navigate and even navigate the healthcare processes?
Yeah, I totally agree. I think there are some many unique challenges that the Asian American, Native Hawaiian, Pacific Islander populations face, that then leads to these disparities. And, the language is one of the top for sure. There is always a delay in the translation of important health information, even after recommendations are put out. Sometimes it's weeks or months or even years before translation in certain languages is available. So we're always, a step behind, and that's where many of our community partners and health systems can help, right, to advocate for and facilitate access to our communities that speak a language other than English. I think the other barriers have to do with access to care more generally. Many of our Southeast Asian communities have high rates of uninsurance, right, of not having access to health insurance. And even those that have insurance, in terms of vaccine access, vaccines, I know there is a myth there that physicians make a lot of money from giving vaccines, and that is completely untrue. And in fact, that is a major barrier because many, especially in our communities, many folks are served by solo small group practices who have to buy their own vaccines, at your own risk. And many are spending tens of thousands of dollars doing that. So being able to, acquire and have those vaccines available for patients and families when they need it is a big challenge, especially when there's uncertainty and delays in terms of recommendations. We saw this last fall when there was a delay in the approvals and recommendations for COVID vaccines in children, for example. Many pharmacies and physician practices, medical practices did not purchase the vaccine because they weren't sure whether or not it was going to be able to be given, and whether they'd be paid for it. And so thus, even though the vaccine ultimately for families who wanted it and it was recommended, were not able to get it because it was not physically available, the supply where it needed to be. But just to clarify, even with the new guidance that came out, we've heard from HHS that the vaccines will, in the original schedule, will still be covered by insurance, and I think that's something that's important. We message to our families that that these vaccines are still covered, and that we continue to advocate to ensure that they are still accessible.
Yeah, and if I could add on to what Celia and Dr. Wu was saying, another significant barrier is just a shortage in healthcare providers nationwide. Like, we know that there's a significant shortage of healthcare providers, and sometimes in the communities where our participants are and where we live, that's where we're lacking providers the most. And when there are providers there, much like Celia was saying, many of them are from a different cultural background. They don't speak the language. And so it's truly hard to communicate with the patients and help educate them and build that trust in such a way that they understand why it's important to follow these recommendations and why it's important to help protect your children. One of the things that was quickly evidenced here at NOELA was that it was intentionally put in a large Vietnamese community, and then this was right after Hurricane Katrina when we started, and so we had a large Latinx population that came in. I've been in the healthcare space now for about 24 years, but it's here at NOELA for 17. And so I was well aware of the evidence that concordance between the race and ethnicity of the provider with the patient that they serve goes a long way in improving the quality of care that that patient receives. And so we were very deliberate in making sure that our staff and our providers were as diverse as the population that we serve. And so we did seek out to make sure we had Vietnamese providers that were very fluent, that as much as possible, maybe even was born and raised in Vietnam. And so they understood the culture, they spoke the language, and they could relate to the community on an intimate level. And same thing with some of the other cultures that we are taking care of here. And that's important because that's how trust is built. When you have someone who understands your culture, understands the struggles that your people have gone through, then they can explain it in ways that resonate the most. And so it is important. So I think the healthcare shortage and then that discordance between the provider and the patient sets up for barriers. So what I would add is that is why federally qualified health centers exist, is to help address some of these barriers, barriers in shortage of healthcare providers, barriers in shortage if it comes to lack of insurance, and sometimes even transportation. Many health centers have transportation services. They have access to vaccines that are intentionally set aside for uninsured or underinsured individuals. And some of our fees are set to be discounted based on the income of the individuals that we serve. And so, as I like to tell my staff when I bring them on, we're designed to be experts in taking care of those who are either uninsured or underinsured. And so it's our job to make sure we can find solutions to the common barriers that are facing healthcare.
Absolutely. Thank you. Yeah, that's extremely important context. And like you were speaking to that trust is such a huge element in having folks able to access vaccines and feeling safe and like these are effective measures to prevent diseases. I am wondering, speaking more to that trust, like what strategies have you seen to work to increase reach with these communities, especially in terms of policy solutions. Are there any stories that come to mind for you? Any lessons learned? And personally, I'm curious too, in my own work, we want to collect stories from folks who are feeling this fear and maybe distrust. But it's hard at the same time to have folks comfortable to share their stories. So maybe are there any tips you have in that area as well?
Well, I'll start off with our distinguished panel. The one of the things, the whole thing around relationships matter, and Dr. Winfrey, you were talking to that too. And even in healthcare, I feel like it's really important for communities to find their voice within that system. Because when we even there was a project that I was involved in here in Washington State, Chuukese, huge population of Chuukese family, Micronesians. Um, we were able to find a grant to actually hire on three community folks from the Chuukese community to work within the clinic. Once they got in the clinic, nobody talked to them because they don't have relationships. So, and I noticed that a lot of folks who are on this call are actually from big institutions too. And I'm always asking, even schools, what are the ways are you guys touching community? Where are the opportunities for the communities to touch your work? And so the same thing applies here. Our ability to really work with systems and communities to help them touch the work around vaccination and internalize all of this work, the research that there's people out there, they could, they could spit this out in ways in communities that we can't, right? And so how do we build those relationships that really matter, that are meaningful for community, where the actual direct contact is somebody who is of that lived experience and the culture and understands the cultural nuances of communities like Dr. Winfrey had shared. It's relational. The way that we deal with each other is all about relationships. And so, how do we get our system and institutions comfortable to kind of, shift to the way of taking care of families and what that means for communities? So, relationships is really huge.
Yeah. And I would just echo what Celia was saying. Many times here in our clinic, we found that bringing on community health workers has been a great addition to the service that we provide. Our providers oftentimes, only have 15, maybe at most 20 minutes to spend with a patient. And there's a lot that they're trying to cover within that time frame. But adding community health workers as extenders of the care team allows them to be able to connect with someone on a more intimate level. And these community health workers come from the community, right? They go to church together. Their children go to school together. They interact with them on some of the soccer teams in different places. And so they know them in the community. And so when they're working here, they already feel a degree of trust because they know who this individual is. They already have a relationship with them. And so
Absolutely.
many times it allows them to be to spend more time with the patient explaining in detail, why the provider was recommending this and why the provider felt that immunization was important. And then the other thing is just reminding them of their schedule, right? Because many times, there's so many things to juggle. We get so busy that sometimes the family just don't remember when the next vaccine is due or which ones to take. And so these community health workers do a great job of just helping to remind the families that, hey, you're due for this vaccine this time, please go ahead and schedule an appointment with us.
I love that. And Celia, back to what you were saying about the trusted community messengers and being able to relate. I think that story element is so important. I think back to when I first became interested in working on vaccine campaigns in medical school, which was shortly after the hepatitis B vaccine was approved and recommended. Going to the communities in Chicago, to the Southeast Asian communities and Korean communities, going to the schools. What really inspired me was hearing the stories from the families who, there were their moms, grandmas, aunties, uncles who had hepatitis B and had end-stage cirrhosis or liver cancer, and it was deeply affecting their families immediately. And hearing that and knowing that we could prevent that from happening, that this child I was giving this shot to today would never have to endure that, that really stuck with me. And I think we need to be we need to be listening to and elevating the stories of folks in our community, so that when when I talk to patients about vaccines, it's always, I heard this friend of my uncle's cousin, and I heard this story, and this is why I'm worried. We need to have our own stories to be able to counter that. We need to I love that that the forum is collecting stories. I think that's so important in trying to counteract that, so that we can all go to our Lunar New Year celebrations and be telling those stories to family and friends when they have these concerns that are brought up. So it's so important. And then to take that to the next level, as Dr. Winfrey was mentioned, how can we embed this in our healthcare system, right? So it is part of the way we deliver care. I think as public health advocates, as members of our healthcare community and system, we also have an obligation to make sure that we are meaningfully engaging and embedding community voices in our work and increasing the capacity of our community organizations, not just doing vaccine fair here and there, but in a meaningful longitudinal way, because the health of those organizations is and that ongoing partnership is what's going to develop trust over time.
And I think just to piggyback on what you're saying, Dr. Wu, one of the best ways to get information out to community is to utilize nonprofit organizations, give them capacity to hire people from the community, and they're laser focused on vaccination information. And these, there are people that the community will identify as the folks who go out and will speak to vaccinations and just talk about how that happens, how to unpack it, and then work with systems too to better inform the way that they're working with communities. And so nonprofits and community groups are always the challenge of capacity and the amount of work, because they're also dealing with immigration and all these other kind of competing priorities and families in BIPOC communities. And so that's one of the things that I always want to lift up is, let's, for systems folks and those that have resources, if there's a way that communities can access resources for capacity to do this work together, is even more another great way of communicating the reality of vaccinations. So.
Thank you. Absolutely. Huge thank you to the panelists here today for bringing their expertise and helping us to contextualize the latest events of the world. And thank you to you all in the audience for tuning in. I do want to just ask before I leave you all, if anyone in the audience has any more translated resources, questions, or stories you'd like to share with us further, we'd love to hear from you. If you do, please reach us at policy@apiahf.org. Let me drop this in the chat. And please reach out. And with that, there we go. Thank you to you all. Please stay warm, be safe in these times. Thank you all for being here, and take care.